Sababa from Accra, Ghana. Welcome. Thank you very much. All right, so it's time up. We are about to get it started. So thank you very much once again. It's another weekend, and it's the weekend health talk. And I'm your humble host, Albert Sedunia. Do this weekly to help reduce the level of misinformation, especially on social media when it comes to medical issues. And I intend to most always host specialists from the different medical fields. And today we have an amazing specialist, an expert in the field of psychiatry. She's a specialist psychiatrist. She works at the Kolebu Teaching Hospital Department of Psychiatry. She's a member of the West African College of Physicians and a member of the Ghana College of Physicians. Please, it is with much honor I want to introduce to you Dr. Abigail Na-Ayele Harding to share with us on the topic anxiety disorders. We chose this topic because there is an upward trend and we are getting to see a lot of people with such conditions, and we deem it fit for a lot more people to speak and hear from the experts. So Abigail, over to you.
Thank you very much, Dr. Sedwin here, for inviting me. It's a pleasure to be here. So I'll go ahead and share my screen. I hope I'm audible and visible.
Yes, you are audible and visible.
Okay. Okay, so I hope my screen is visible as well.
Yes.
Okay, so good afternoon, everyone. Today we are discussing anxiety disorders. My name is Abigail Harding. I'm a specialist psychiatrist with the Department of Psychiatry in Kolebu Teaching Hospital. And this afternoon, I hope that we'll be able to understand the terms anxiety and fear when we talk about, we'll talk about what anxiety is, what fear is, how it's related, how the two terms are related. We'll look at some disorders of anxiety, what some of the causes are, what can cause anxiety disorders, and look at the symptoms as well, and briefly take a look at how to manage and treat these disorders. So I want to start off this discussion, this presentation, with a quote I found where imagine yourself asking what could possibly go wrong. And anxiety is a person who replies or responds to you, I'm glad you asked. So anxiety is it's a normal and necessary human emotion. It's something I'm sure we've all experienced before. And it helps us to, gives us an extra push we need when we need to do certain things, when we need to write exams, when we need to take adventures, we need to jump off a cliff or dive or something adventurous like that. So it's a vital human emotion, but it is uncomfortable and it can make a lot of things go wrong. So what is anxiety? It's an anticipation or apprehension about a future threat. So when you are expecting or thinking about something that's bad that's going to happen, some adversity about something, about a future threat, you don't know it yet, but you have this anticipation, you are apprehensive about it. While fear is an emotional response that we have to an immediate threat. Now, this threat may be there in front of you. If you have a lion in front of you, definitely, yes, you should be fearful. It may be a perceived threat. You may not have seen something, but you may have heard that a lion is about to charge you. So yes, you will be fearful. And they are both associated with different physical changes in the body. They can both be helpful. I mentioned that we need anxiety sometimes to help boost our performance. And then fear also can trigger what we call the flight or fight response. So it can save your life. If you are fearful, you run away from something, a dangerous situation. And anxiety will help increase your preparedness, at least in moderate levels. So what are the anxiety disorders? Now, the anxiety disorders are psychological disorders where you have an exaggerated anxiety response. So the anxiety is persistent, it's distressing, and it can be triggered by trivial things or even something non-existent, a non-existent threat. And they usually include disorders that have features of excessive fear as well. That's why the terms are related. You can have anxiety with fear. When we talk about anxiety disorders, a lot of times people think about panic attacks. Yes, panic attacks are a prominent feature of anxiety disorders, but they are just one particular type of response. So we'll look at that in a little bit more detail as we go along. And these disorders affect the quality of life. So that's why we are talking about them. They can disrupt people's lives, relationships, work, and they are one of the most common mental illnesses around. Now, out of the large group of anxiety disorders that we'll take a look at, the most common of these disorders are the phobias. We'll look at the specific phobias a bit later. So it's important to note that anxiety disorders involve more than just temporary worry or fear. We are all entitled to have some amount of anxiety. This is something that we need to be aware of because, like I mentioned, anxiety increases your performance. It can help boost the level of preparedness that you need to do something important, either be it prepare for a job interview, prepare for an exam, do something adventurous, something you wouldn't normally do. It helps you boost your preparedness and boost performance. But the disorder itself is more than that type of anxiety. It's more than a temporary worry or fear. So for a person with an anxiety disorder, the anxiety doesn't go away, and it usually gets worse over time. So what's the difference between anxiety, normal anxiety, and anxiety disorders? We've alluded to that already, but this picture sort of depicts what these differences we are talking about. So normal anxiety usually triggered by something specific, a specific problem, a specific thing you're about to do. While anxiety disorder is usually doesn't have a specific cause or reason. You can't pinpoint why you are experiencing that anxiety. Now, for normal anxiety, usually goes away when the stress is removed. When you finish that interview, when you finish doing that important thing, that big thing, big presentation that you need to do at work to seal a deal, to get some money, to make moves and make deals. When that is over, you sort of have this huge breath of relief that it's gone away. You've removed the stressor, so there's no the anxiety has gone back down to zero. But with anxiety disorder, it's intense, it's out of proportion, out of control. And this is why it's a disorder and they need medical treatment. And for normal anxiety, it happens for a short period of time. With the disorder, it lasts for weeks, months, or even longer. And like I mentioned, as an example, normal anxiety, you feel nervous before a big presentation, but with an anxiety disorder, regardless of the presentation, whether you have a presentation, you have a job interview, you have something to do, there's this constant fear of doing or saying the wrong thing. So this is just a further more details on the difference between anxiety and normal anxiety and anxiety disorder. So a normal reaction to stress or difficult times like paying bills, a breakup, losing a job, or even gaining a new job, you can feel anxious because you are worried about what's going to happen in the future. You're anticipating or apprehensive about things that are going to happen in the future. But with the disorder, it's constant, regardless of what is going on around you. With normal anxiety, you have a sweating, you are feeling jittery and nervous. With anxiety disorder, that emotional response is more exaggerated, more excessive. Normal anxiety has usually a starting and ending point, while anxiety disorder is longer. taking a deep breath, relaxing helps you usually feel better with normal anxiety. But with anxiety disorder, it can take a little bit more than relaxing or taking a deep breath. Okay. So let's look at the anxiety disorders in numbers. This gives us an idea of how prevalent it is, how common it is in our society. Globally, about 7.3% of the population have anxiety disorders, and the current prevalence for Africa in 2013 was 5.3%. But a study done in Ghana in 2021 showed that about 53.3% of the participants they studied, over 2,400 participants were studied, and they had anxiety. So it's fairly common. We know that women are more likely to have anxiety disorders, and we say it's strongly comorbid with depression. What we mean by that is it's highly likely that if you have an anxiety disorder, you may have depression as well. So which is why it's something important that we need to look at, and we need to figure out if someone has an anxiety disorder so that we can manage it appropriately. So what's the impact of anxiety disorders? If untreated, anxiety disorders can lead to functional impairment. So when we say functional impairment, we mean your daily activities, going to work, affects your relationships. It can also lead to other mental illnesses. It also increases your risk of poor concentration, reduces your academic achievement, because if you are always anxious, you are unable to concentrate on your academic activities. And it can also make you socially dysfunctional because you are not able to interact well with people when you are always anxious. So what are some of the causes of anxiety disorders? There are a number of them. This diagram groups them into different categories. So the first one we'll look at are childhood or past experiences. So childhood experiences, in particular, trauma, punitive parenting styles, where parents are very punitive, overly strict, if there's any abuse during childhood, if there's bullying during childhood, those experiences can make a person more likely to develop anxiety disorders in adulthood. Now, we also know that people who have anxiety disorders usually have family members who also have anxiety disorders. That suggests that there may be some genetic underpinnings to the disorder, which means that it could be in families. If your sibling or a relative has an anxiety disorder, it increases your risk of also having an anxiety disorder. Now, some type of diets, particularly diets high in stimulants like caffeine, can cause you to have anxiety disorders because they stimulate your physical responses, exaggerate some physical responses that can present like an anxiety disorder. Now, also some medical problems, we'll look at that in the next slide, can present like anxiety disorders. Having negative life events, a loss of a loved one, unemployment, major stresses, a loss of a child can all predispose you to developing an anxiety disorder. Now, drug and alcohol use can also do the same. Alcohol, sometimes people rather use alcohol to reduce their anxiety, but it can have the opposite effect where it increases anxiety. So these are some of the medical conditions that can cause anxiety disorders. It's important to have this at the back of our mind because it's not always something from childhood, something from diet. It could be a medical condition that you have that may be presenting as an anxiety disorder. That's part of the reason why it's important to be able to identify it and then come to hospital. We can do a thorough assessment and then manage appropriately. So the symptoms of anxiety disorders are varied. This diagram shows that there are lots of symptoms. There are a myriad of symptoms, so many different things, and there's no one specific way in which a person can present with an anxiety disorder. Two people, even twins, can present with very different symptoms of anxiety disorder. So it's just important to note that so many different things can be part of an anxiety disorder. So some of the common ones are feeling nervous, jittery, unable to sit still, feeling dizzy, trouble sleeping, your heartbeat racing, feeling like throwing up, having nausea, having a dry mouth. These are the pretty common ones. But like I said, there are lots of other symptoms. If someone doesn't present this way, they could present in another way with an anxiety disorder. So this diagram divides, categorizes the symptoms of anxiety disorders. So you can have them physical, which are usually the ones that people tend to notice first, where they are feeling dizzy, they are sweating excessively, their heart is pounding, it's racing, they feel jittery, they feel tense, they're unable to relax, they are restless, pacing up and down. It's like they just can't sit still. For psychological symptoms, they may just get angry easily for no reason, or feeling on edge and finding it difficult to concentrate, being indecisive. Behavioral symptoms include things like avoiding certain situations because you know that it can trigger you to feel anxious. So they don't want to go to certain areas, they don't want to hang out in certain places because they know it can trigger their anxiety. So there are different types of anxiety disorders. We've been talking about anxiety disorders, but there are different types, and there's no one specific way that a person can present. They can present with any of the different types of anxiety disorders. But this diagram shows the common ones, and these are generalized anxiety disorder, social anxiety disorder, the phobias, and panic disorder. For generalized anxiety disorder, it's also called free-floating anxiety disorder. So this is where the anxiety is just like everywhere. It's persistent, it's excessive, daily activities, every little thing is worrying you, every little thing is bringing you anxieties, making you tense. There's no one specific thing. It doesn't happen in episodes. It happens all throughout the day. There's this like background constant anxiety. For social anxiety disorder, you have an intense anxiety about being embarrassed or rejected in social situations. So such people like to stay alone, don't want to be in a social setting, don't want to go out to people because they find it difficult to, they find it's embarrassing. They become anxious, so intensely anxious in those social situations. While the phobias are related to a specific object, activity, or a situation. These are common ones that people know about: fear of heights, fear of spiders, fear of needles, fear of blood. We'll look at that a bit later. And then panic disorder is where you have episodes where you have the main symptom is the panic attack. So this is what we mentioned earlier, that you can have panic attacks, but this time it comes in episodes where you have this intense fear or intense anxiety that lasts for about 10-15 minutes and then it passes away. It feels like you're about to die. It feels like you are going, you don't know what's happening to you. That's panic disorder. So some of the others not shown on the other slide are separation anxiety, which is more common in children, which occurs when a person leaves you, a person you are close to leaves your side. We see it in toddlers often when they start school, they have separation anxiety. They've been with mommy and daddy for their whole lives. That's about 2 years of life, and suddenly you move them away to school, it becomes, they can develop some anxiety from that. Agoraphobia is one of the phobias where we'll talk about that when we look at the specific phobias. Okay, so generalized anxiety disorder, like I explained earlier, you have this generalized anxiety. When we say generalized, it's everywhere. It's free floating. Doesn't matter which specific situation. And you worry about a lot of normal things, normal everyday things. So something normal can trigger worry. And then you have this diagram shows you one small worry, one particular normal situation can trigger some worries or some anxieties. Then it starts growing into other worries. So you have one, you are worried about something bad happening to at work. Then it makes you worry about something happening to your child, something happening at home, something happening to your family. Then before you know, it spirals over, and now you are worrying about Ghana, the world, you are worrying about Ukraine, Russia, things that are out of your control. So that's when you have generalized anxiety disorder. One thing can trigger so many worries. And you start to develop worst case scenarios. You're always thinking the worst thing that could happen. So again, the symptoms are like the other symptoms you would see in an anxiety disorder: headaches, muscle aches, unexplained stomach aches, feeling on edge, feeling tense. And this time it's throughout the day, so or throughout any activity that you are doing. So for panic disorder is where you have the panic attacks, unexpected, recurrent panic attacks. So you don't know when you are going to experience that panic attack. And remember, we mentioned that the panic attack is this sudden, intense episode of fear or anxiety, and it's recurrent. So it happens more than once, multiple times a day or during the week. And you have this worry of having new panic attacks. So you are worried that you've had one and you don't know when you are going to have another one. So the panic attack looks like this. You have sweating, trembling, shaking, tingling of your hands, feeling dizzy, your chest is tight, you can't breathe, your heart is pounding and racing. And this lasts for about 10 to 15 minutes, where you feel like you are literally going to die, like something bad is happening to you. The world is ending. For those short few minutes, it feels so bad, so intense. So that's a panic attack. And when you have recurrent ones, then we call it a panic disorder. For the specific phobias, these usually start in by age 11, 12. You would have developed a phobia if you were predisposed or you had some negative life experience around that situation or that object. So fear of heights, fear of spiders, fear of dogs, fear of needles, fear of blood. And I mentioned agoraphobia is where you have a fear of a place where you are unable to escape. So you feel if you are in a car, you're in a bus, you're in a plane, you feel like you can't escape because the car is moving. You can't get out. So you have this fear that you are in a place where you are locked up. Okay. This just goes on to explain more of the specific phobias. Okay, so social anxiety disorder is also one of the phobias, but we take it out so that we can explain it a bit further. It's also called social phobia. And this is where I was talking about that the person feels as though they feel embarrassed or feel like they are going to be rejected. They are anxious in social situations. So they tend to avoid those social situations. So for social anxiety disorder, usually also starts somewhere in teens. in the teenage years, and it can affect about 1 in 3 adults. It's also associated with other anxiety disorders, other mental disorders. So what you need to remember with all the anxiety disorders is that it makes you more likely to have other mental disorders. So some of the symptoms, again, you notice that across all the anxiety disorders, we are having the same symptoms, similar symptoms. They can just present in a different way in different people. So they may have different combinations of symptoms. So another thing to note is that social anxiety disorder is not shyness. It involves an intense fear of being scrutinized and judged. So shyness is more of a personality trait. You lack confidence with strangers. You are more comfortable with familiar people. But with social anxiety disorder, you have this, it's not that you lack confidence, it's that you have an overwhelming fear or anxiety in social situations. Anytime you are with a group of people, if you go out to the club, you go out to the bar, you go out to a party, a wedding, a funeral, those situations where you have a group of people makes you so anxious, and you feel so overwhelmingly afraid of what's going on there. You fear that you are going to be rejected, and that is social anxiety. So it may be the reason why someone may decline coming to your wedding or accepting an invitation. So it's a bit different from an introvert or someone who's shy. Those two, introvert and shyness, are personality traits. They are different from social anxiety disorder. So now that we've looked at the different anxiety disorders, is there any help available for people with anxiety disorders? Yes, that's a resounding yes. There is help available, there is treatment available, and there are a number of different therapies, medications. There's also psychotherapy, which is also called talk therapy. There are also other alternatives like meditation. In other cultures, they practice acupuncture. In the Chinese cultures, Asian cultures, they practice acupuncture. Some people also believe in aromatherapy, where you use salts and sweet smelling liquids to help relax you and calm you. Also, lifestyle changes also improve anxiety. So proper sleep, healthy diet, exercising, joining a support group, avoiding smoking and drugs. All those are different ways of reducing anxiety. So what can you do if you have anxiety? Not necessarily an anxiety disorder, because in that case, you would need an assessment and then possibly medications or psychotherapy or a combination of both. It's for the management, you need to know that you can have a combination of all these different therapies. You can have just one or the other, depending on it will depend on a case by case basis. So it's not just one size fits all. But what can you do yourself to manage your anxiety? If you notice that your anxiety levels are going up, you don't want it to get too bad, to get too extreme or persistent, you can reduce your stress level. Practice exercise, physical exercise, take deep breaths, relaxation, eat a balanced diet. These are things that we know, but we take for granted and we don't practice. But there's a reason why they are so-called common knowledge, but we don't do them regularly and consistently. Also, don't be afraid to ask for help. If there's something you need help with, don't be afraid to ask for help. You also need to take care of yourself. If you need to rest, take a nap. You need to take time off. then you do that. Focus on the present moment. Try not to focus on things that are going to happen that are outside of your control. So be focused on the present moment. What do you do to help someone who you think is experiencing anxiety? It's important to get an understanding of what they are going through. You may be able to direct them to an appropriate place, be it a clinic, a psychiatrist, or a primary care physician to help to assess them. Let them know that you are there for them if there's something they need support-wise, if you can help. Be willing to talk to the person. Now, it's best not to enable their anxiety or put pressure on them or get frustrated with them and expect immediate change. I find that people feel, just don't be anxious. Why are you anxious? Don't get anxious. Just calm down, relax yourself. It doesn't work like that. If you have an anxiety disorder, it's a disorder for a reason. It doesn't change or stop with you expecting immediate change or getting frustrated with them or putting pressure on the individual. So what helpful things can you say to a person with anxiety? You can tell them that you can ask them what they need, if they need space, if there's something difficult they are going through, you can be there to listen to them. You can encourage them. You tell them that it's not their fault, it's a disorder. There are multiple factors. We looked at the causes, multiple different things that have contributed to the disorder developing. And it's unhelpful to tell them, calm down, don't be dramatic, just think positive. It's not that bad. There are people worse than you. So why are you anxious? No, that's not helpful. So what do we want to take home about anxiety disorders? They are the most common mental illnesses we manage in our clinics, and it deals with persistent, excessive fear or worry in situations that are not particularly threatening. There are different types. Today, we looked at generalized anxiety disorder, panic disorder, the specific phobias, and social anxiety disorder or social phobia. There are different risk factors or causes. We look at the fact that it can run in families where it has a genetic basis. Some past life experiences can also lead to anxiety disorders, physical illnesses as well. There are some complications that can result from untreated anxiety disorders. That's why we want to make sure that everyone knows about it and gets help as soon as possible. And there are a number of treatments available for people with anxiety disorders: medications, psychotherapy, lifestyle changes, joining a support group. And like I mentioned, there are a myriad of symptoms that a person may present with. So if one person A has anxiety disorder, has a particular symptom, it doesn't mean person B has the same symptom as person A. So thank you very much for your attention. I hope you've gained some knowledge about anxiety disorders. And if there are any questions, I'll be glad to take them now.
Thank you very much. That was very clear, straight to the point, and very explanatory. And it's the reason for this is because there's been an increase in the people coming with anxiety disorders. And the reason for this partly also is that we want people to know that there is help available. They don't have to go through it all alone. There are people who have had conditions like this that have been treated and are doing well now and I know how best to go about life. So the reason is to educate us, to have knowledge, and to let everybody know there is help. And we appreciate you so much, Dr. Abigail Na Ayele Harding. We appreciate you for the thorough presentation. Please, at this point, if you have any questions, please feel free, put in the chat box in the comment section. Dr. Harding will gladly answer all your questions. Just feel free, drop the question in the comment section in the chat box. Yes. Somebody is asking, first question has come. So the rest of us who have questions, please feel free, drop it in the comment section in the chat box. First question is coming from Nana Kwame. He's asking, how does one control blood pressure? Oh no, blood pressure phobia. That is, he's afraid his blood pressure will shoot up. He's asking, how does he control that?
Okay. Please, should I take the questions now or wait for
No,
all
answer.
of them?
You can go ahead and answer, please.
Okay. So if you have a fear that your blood pressure is going to increase, we need to understand the root cause of why you have that fear that your blood pressure is going to increase. Do you have a family member who has had hypertension or has had negative outcomes from having hypertension? Then also we need to look at circumstances around how your blood pressure is measured. Do you have risk factors for hypertension? Are you taking your medications, antihypertensives? So there are a number of different factors that we can look at. So I mentioned that there are different causes or different risk factors that can lead to anxiety disorders. So we need to find out all these root causes and try to tackle each one of them and see how best to help you, because it's not one thing alone that's leading to you having this intense fear or this persistent fear that your blood pressure is going to go up. What is leading to that? If we can do psychotherapy to help challenge those thoughts that you've been having, that your blood pressure is going to go up, that's something that's available for you. I hope that's clear.
Yes, that's a very clear explanation and guide. Thank you very much. So you need to understand that it's okay for you to have the symptoms that you are having. So that's why you need help. When you come, you seek the help. You'll be guided through what to do. All right. You don't have to blame yourself. You don't have to blame anybody else. All right. We've all had different childhoods. Some of us were beaten mercilessly when we were children. Some of us have had very negative childhood experiences, and sometimes later on in life, it might have certain effect on us. And sometimes stresses of life, like Shirley said, the normal anxieties, especially, that's very, very common. Paying bills. Paying bills can be a source of stress. I tell you, just paying bills, school fees, rent, food, utilities. Trust me. All right. So if you have any question, please feel free, just like Nana Kwame has done, feel free, put a question in the chat box and let Dr. Harding. This is like a free specialist consultation. You're not paying anything for it, all right? So feel free, put your questions in the chat box in the comment section, and Dr. Harding will gladly help us. Another question has come. Can anxiety cause nerve damage?
Okay. So anxiety, persistent untreated anxiety can have different complications. And we talked about the fact that you can have short-term memory loss. It can increase your risk for heart attacks, or what we call myocardial infarctions in the medical parlance. It can also increase your risk for other heart diseases. It can suppress your immune system. So in that way, it can also lead to other digestive disorders. In that way, it can affect your different organ systems in your body. I hope that gives you an idea of, or that answers your question.
All right, thank you very much. Another question is, someone is also asking on YouTube that the person first of all says, thanks so much, doctor. Please, how can I come out of my social anxiety disorder? Which means that per your presentation, the person has seen that he is likely to have social anxiety disorder. So he's asking, how can he come out of social anxiety disorder?
Okay. So the first thing is good that you've done, you think you have social anxiety disorder. It would be good for you to come to see a psychiatrist or a primary care physician for a thorough assessment to help us understand truly if you do have social anxiety disorder. What I can suggest is that there are medications available, there's psychotherapy also available, and it's best to avoid self-medication. So using alcohol or over-the-counter drugs to try and manage it yourself, because you can have even worse complications apart from social anxiety disorder that can blow out of proportion beyond what you even started with. So there are ways we can help you out, but first you would need an assessment.
Yes, thank you very much. So you need a formal assessment. This is to help you understand that it's possible you have that condition. So get a formal assessment done, and then there is an array of help opportunities for you to be helped. Somebody is also asking, how long can a person be on anxiety medication? And how does one overcome the fear of being on these medications for life?
Okay. So for anxiety disorders, we usually treat for months, not weeks or days, because these disorders develop over time. So we don't use 1 day, 3 days to manage anxiety disorders. So it can take months, sometimes a year, 2 years, depending on the case or the presentation. But there's no specific answer as to how long a person may be, because someone may be on intermittently. At some times they may have flare-ups, it may subside and we take them off medication. At another time, because life is happening, life doesn't stop. You may have something happen to you now. In 2 years' time, you may have, unfortunately, some major stressor in life, losing your job, losing a loved one, or even something positive happening where you need some support medication-wise. So we may put you back on medication. So it depends. And your doctor wouldn't put you on something for too long that may affect you. And we take into consideration the fact that, yes, you can't, we prefer not for you not to be on the medication for life, but there are some instances where some people may be on for long term. So there's no one specific answer. It depends. That's the short answer to the question.
Yes, very rightly so. It depends on the individual. The aim is for you to be in full recovery, for you to lead normal life and be okay. So based on what you're experiencing, your doctor will advise you. Someone is asking, please, will your advice we treat the signs and symptoms such as high blood pressure, dyspnea, and others when these people present at the emergency room?
Okay, thank you very much for that question. I'm sure we've all seen people with anxiety disorders in the emergency room. When I was a house officer, we had a number of people coming like this, especially at dawn, 2 a.m., 3 a.m. coming. They are dying, they can't breathe. People have poured water on them to revive them. Blood hypertension has a diagnostic criteria, so we would follow that. If you think that, yes, if they've had multiple readings where they have elevated blood pressure, then yes, you should treat, because people with anxiety disorder can still have hypertension. Just because they have an anxiety disorder doesn't mean they can't have another medical condition. They can't have chest problems, breathing problems, hypertension. That's why it's important that we keep at the back of our mind that they may have an anxiety disorder, but they could have a medical condition. So if you have repeated visits, this person is coming to your emergency room multiple times, you've been treating, you've managed their blood pressure, it should think they are compliant on their medication, but still they are presenting with these episodic symptoms, then yes, we would want to treat for anxiety disorder. But at that time that you see the patient, yes, it would be good to calm them down, get their blood pressure down, and make sure that they are medically stable. before you send them over to us for an assessment.
All right. Thank you very much, doctor. Now, another person is asking, can anxiety be treated 100%? This is a very common question to all doctors globally concerning every condition. All right. So, again, I want you to hear from the experts. I'm going to pose it to her. She will answer you. The person is asking, can anxiety be treated 100%?
Again, that's it would be a difficult one to say 100%. Yes, in medicine we try not to deal with absolutes. It can happen, never happen, or it's 100%. No, human bodies are so different. Human brains, human minds, every individual is different. So for someone who may have had full recovery, may have done so well, it may not happen for another person. And it doesn't mean that person has done something wrong, or that person is weak, or that person, somebody is following them, their family is against them. No, it just means they have a different makeup, a different constitution. So for that person, the anxiety needs a little longer or long-term treatment. So we can't say 100% all the time. It may work for some people, it may not work for others.
Yes, thank you very much. In medicine, we say never say never. So, yes, it's not absolute in that. But what we are trying to let everybody understand is there is help for everyone with anxiety disorders. Your case will be treated as your case, not to be compared generally overly to everybody else's. So, yours is to seek help and adhere to the advice that your doctor, your caregiver will give you. All right. Thank you very much, Dr. Harding. Any more questions? Any more questions? Please put in a chat box, and Dr. Harding is going to answer your questions. Thank you very much so far. The presentation has been straightforward. I like the comparison between normal anxiety and anxiety disorder, and I like the comparison between fear and anxiety. It was so simple, straightforward, pictorial. Thank you very much, Dr. Harding. I enjoyed it, and I'm sure everyone else who joined us also enjoyed it. For those of you who joined us a bit late, no problem. The recording will be shared on the YouTube channel. So if you've not subscribed to the YouTube channel yet, you can do so. If you have friends that you want to also, especially if you've come to listen to this and you realize this might help a friend of mine, feel free, share the YouTube link with them. They go there, subscribe. They'll have access to watch the replay, the recording there as well. We have a few minutes to go. Please, if you have any more questions, please put in the chat box in the comment section. Dr. Harding is giving free specialist medical advice, free specialist medical consultation. If I were you, I would ask all my questions, Please, children who fear their teachers in class, is it anxiety?
It could be. It could be anxiety, but it's not necessarily an anxiety disorder. We are all entitled to have some anxiety where we meet the one who is going to discipline us and holding the so-called cane in the classroom. So yes, you may be anxious about going to school, or anxious about your teacher or being in class because you are worried about your performance. But like I mentioned in the presentation, it can boost your performance, because when you are anxious about it, then you have a child who's willing to do homework, willing to do more exercises, willing to practice more. So it can be a good thing if we manage it well.
All right, so just to add a bit to what Dr. Harding said, if a child is out of place, afraid of a class teacher, it's your interest to find out possibly why. Yeah. If a child is out of place, afraid of a relative, anyone at all, it's in your interest to find out why. There may be a reason why that child may be communicating to you something that is going on that you may not be aware of. So don't just take it lightly at all. Just investigate and find out that he's just afraid because the teacher may punish him or her if he doesn't do his homework or whatever. Yes, but try always to listen to your children. They are talking to you. and investigate more to know what is it that is happening in school that you may not be aware of. Now, a very important question, and I want Dr. Harding to handle this. Someone is asking, and this is to the general public. We need to get this argument settled, all right? So the question is, are psychiatrists psychologists?
This question.
Yes.
So, so psychiatrists and psychologists are usually different people. But psychologists, psychiatrists can be psychologists. Now, there are a number of differences between the two professions. Psychiatrists, by definition, are medical doctors. They have gone through a medical program, at least 5 to 6, 7 years of medical school, have come out and have gone through another rigorous training program to become psychiatrists. Then, and usually because they are medical doctors, they can diagnose an extensive or a broad range of mental illnesses and prescribe medications as well. They can also do some amount of psychotherapy for the patient. Now, psychologists are not necessarily, the key word there is necessarily, medical doctors. We have some medical doctors who are psychologists, but they are not necessarily medical doctors. So what you usually do to become a psychologist, you go through university, an undergraduate degree in university, and then come out with a psychology degree. This can be done before you go to medical school, after you go to medical school, or you don't go to medical school at all, but you have a psychology degree. And usually psychologists, because most of them are not medical doctors, cannot prescribe medications, but they do undertake psychotherapies. So that's the talk therapies. So there are two different professions, but they are intertwined and they are related. Currently, we have psychiatrists who are both psychologists and psychiatrists, and we have some psychologists who are medical doctors but are not psychiatrists. So it's like a mix and match in the psychiatry world. It's sometimes I understand where the confusion comes in for a lot of people, but one of the main differences is the fact that psychiatrists can prescribe medications because they are medical doctors. Psychologists usually don't, because most of them are not medical doctors. So they do psychotherapies, talk therapies. Yeah. Is there anything I've left out, Dr. Sedoye?
That is extensive. Trust me, you've covered all angles, because especially the bit about medical doctors who become psychologists but not psychiatrists. That is where it gets a bit confusing to a lot of people.
Exactly.
And also, to even complicate it more, psychiatrists who also qualify psychologists. Then
exactly.
Yes, so that is an extensive example that covered all grounds. What I try to liken it to just make it easier, of course, with that, there'll be a lot of exceptions. It's just, I say, when you go to a hospital, midwife and gynecologist, when it comes to practicality, working environment, the midwife, I can relate them to say they are the psychologists, and the psychiatrists are like the gynecologist. They work hand in hand. We work as a team. None is better than the other, but you should also know that the psychiatrist, by all means, has to be a medical doctor who has also gone through a rigorous training to become a psychiatrist. So he has, some qualifications to do certain they can also give the talk therapy and all that. All right. So yes, so that's a good explanation. Now, someone is asking a question. Okay, if anybody has any more questions, we have only 2 minutes more to go. So this person says, I went to the mortuary when my dad died. Since then, I can't watch people's face. If I do, I get panic attacks. This is really affecting my life. Can I get help? Yes, exactly. That's what this presentation has always been about. For you to know that there is help available. And I'll leave the answer to Dr. Harding to tell us where the person can seek help and how best the person can get the help. And if you need more info, you can reach out to me. Get my contact on from my YouTube channel, and then we'll guide you. But Dr. Harding, the question is to you.
Okay, so yes, there's help available. You can come to the hospital for a formal assessment, be it any of the mental, the psychiatric hospitals, Korle Bu Teaching Hospital, Accra Psychiatric Hospital, Pantine, or even your primary care physician. You can also see your primary care physician, who can also then direct you to one of our facilities where it's convenient for you. But yes, there's a lot of help available. You can also see someone privately. There's lots of help all around.
Yes, a lot of people are suffering silently. That is why talks and presentations like this are very necessary. A lot of people are suffering silently. I don't know how long your dad passed away, but I'm sure you've been going this thing for a long time now, and you may not even know that there is help available. People may just be talking you out of it, but you need assessment, formal assessment, and then you get the needed help. A lot of people are suffering silently because they don't even know what it is they may be experiencing. That is why we are uncovering all the symptoms for you to understand that it could be this, it could be this. Get the needed help, and there is help available. In the next 30 seconds, I will give opportunity to everybody. For those of us who join us late, don't worry. The recording will be shared on the YouTube channel. If you have not subscribed to the YouTube channel yet, please feel free to subscribe. And I'll post the recording a few minutes after we end the call so that you can go and watch the whole video. When you watch the full video, I'm not sure you have many more questions because she went through everything methodically and everything was clear. It was very neatly done. The question I've been waiting for, and it has finally come. Can anxiety disorders be cured? And can the person continue to work?
So yes, the simple and short answer is yes. Anxiety disorders, we manage them. And depending on the type of anxiety disorder, depending on the case, depending on the presentation, there are some anxiety disorders that we are able to treat and manage. And there's also help. There's help for all of them available. But yes, the aim of our management, especially in mental health, is to enable you return to work, enable you to return to your daily life, to your activities, previous activities that you used to do. So we usually consider it a success when you are able to return to work. So that's the aim of what we try to do, of the therapies that we offer, the treatment that we offer. So yes, anxiety disorders can be treated, they can be managed. There are different therapies available. Yes, that's a simple answer.
Good. So I have another question. People are now coming up. Please, we have only 1 minute more. Somebody is asking. Some children withdraw in class participation, but they become lively when their parents are taking them through the same lessons taught in class. Please, can this be a form of anxiety or fear?
Yes, it can be. But again, we would need to understand the reason why the child is withdrawing or not participating. What's the underlying cause? Is there something else at play going on? Remember that children don't tell us directly what's going on with them. They show us through their actions. So it's up to us to try and figure out. So the another attendee previously asked that about the teacher. If a child is anxious with a teacher, we need to find out why the child is behaving that way. What's the underlying cause? Before we can say whether it's related to anxiety or not. But it is possible, yes.
Yes, thank you very much. Children, these days, most parents are so busy, we don't even pay attention to the kids. They talk to us indirectly. Some children may be going through some trauma in the hands of a relative, a close relative or whoever, a close caregiver. They may not voice it out, maybe because they've been warned. They will be going. You just have to investigate, find out why. And if your child is behaving this way, again, just investigate. Let your child be seen by a professional. Formal assessment is done, and the appropriate help is given your child. Thank you all very much for all your participation, for making time. Again, I saw a lot more people join us late, so I'm again advocating that for your full understanding of the subject matter for today, anxiety disorders. We went through fear and anxiety, the differences. We went through normal anxiety and anxiety disorders. There's a difference. We learned that you need some level of anxiety to increase your performance. We also learned the various types of anxiety disorders and how to go about it. All right, so if you join us late, don't worry, the recording will be shared on the YouTube link. If you've not subscribed yet, feel free subscribe to the YouTube channel, and I'll be posting the recording. And feel free to share with your friends whom you want to also benefit from this presentation. We thank you so much, Dr. Abigail Ayele Harding, for such a beautiful presentation. I like the slides, the content, and everything was on point. Please join me together. Say thank you, Dr. Harding, so that she knows that we appreciate her time that she spent with us. She's quite busy, but she decided to sacrifice to make time for us, to share with us this expert knowledge. Please, everyone on the call, please put in the chat box, thank you, Dr. Harding. Let her read it and know that I'm not the only one saying thank you. Yes, people are chatting on the side and saying, yes, they enjoyed the presentation. It was very informative. So thank you very much, Dr. Harding, for making time for us. And anytime we call on you again, we are hoping that you will accept our invitation. We are like Oliver Twist. Lots and lots of things we want to learn from you. Thank you very much. It was a beautiful presentation.
Thank you so much.
My audience, thank you all very much for making time. My YouTube family, we are growing. Thank you very much for sharing the link and always getting people to benefit from the knowledge that is shared. Until we come your way again, it's been a plum pleasing pleasure serving you all. Good evening, good morning, good afternoon, based on the time you get to watch this video or the time you are joining us. Thank you very much.